So good morning, everybody. My name is Kirsty Southern, and I am here today to talk to you about some of the in-demand jobs and qualifications that we have in the health and social care sector. Okay. If anybody does have any questions as we're going through the webinar, please feel free to pop them in the chat, and I will try to answer them at the end if we get time. If not, somebody will come back to you. So hopefully today we will be able to give you a clear practical guide to careers, qualification and progression in the UK health and social care sector, and hope that you will learn about the most in-demand roles and salary expectations, qualifications that are required to enter and progress, career pathways from entry level to leadership, and how South London College courses connect to employment. So a little bit about us here at South London College. Okay, we are a UK-based online education provider who deliver flexible career-focused qualifications that are accessible at any time, anywhere to learners worldwide. We are 100% online, which allows us to deliver fully flexible learning that fits around life and commitments, Ofqual regulated, so our qualifications are awarded by recognised UK bodies including Qualify and NCFE Cash. We are also expert tutors with industry experienced tutors delivering career force practical learning, and we help to deliver good employment outcomes. So every course is designed with clear career progression and employability in mind. So just a little bit about myself. So as I've said, my name's Kirsty. I've got 20 plus years experience as a health and social care trainer and assessor. My background is that I used to be a manager for our services for people living with mental health needs, learning disabilities, additional needs in relation to neurodiversity, things like that. Also means that they would experience physical disabilities as well. You can see my qualifications on the screen. So I have a qualification called a Registered Managers Award, an A1 Assessors Award, which allows me to deliver health and social care qualifications up to level 5 and also in residential childcare. I've worked with individuals with work-based learning and apprenticeships from level 2 to level 5. I've worked at every level of care, and I have delivered training across safeguarding, mental health, trauma, adverse childhood experiences, restorative practice, and condition-specific topics. So I've delivered training around conditions like autism, ADHD, cerebral palsy, mental health needs, lots and lots of different things. Going through today, just a little bit of statistical knowledge for you. So around the UK health and social care, telling you a little bit about the sector and the scale of it. So health and social care is actually one of the UK's largest and fastest growing employment sectors, with demand consistently outpacing supply. We have a 4.97 million workforce, with 106,000 plus NHS vacancies. So that's open roles across the NHS as early as 2026. We have a 360,000 projected shortage. So that's the estimated staff shortfall by 2036 to 2037. The median salary within UK-based health and social care sector is around 28,870. So the social care vacancy rate stands at 3 to 5%, which is 3 times the UK national average, driving continuous urgent hiring demand. And unfortunately, that has been the case in health and social care industry for quite a long time. I have known all along throughout my career in health and social care that one thing we desperately need is good members of staff and people who have a commitment to supporting people who have health and social care needs. So why are we so in demand within our sector? So we've got lots of structural drivers. Okay, so within the UK, we do see that we have an ageing population. Some of these are great things. Okay, because it means that we are supporting, enabling people to live longer, partly because we've got improved healthcare, better understanding of health and well-being, but it means that we currently have about 18.5 million people aged over 60. It means that we do have a rising prevalence of chronic health conditions, and unfortunately at present we are experiencing a mental health crisis with 1 in 4 adults affected each year. We also see that because of the wonderful COVID pandemic that we all experienced from 2020, there has continued to be a huge amount of pressure on services. The NHS workforce shortages and government expansion plans also mean that within this sector we are still seeing significant lack of members of staff. The combination of this demographic change and the systemic underfunding means that health and social care offers exceptional job security and career stability for years to come. Okay. So I'm going to run through some job roles with you so that you get a little bit of an understanding of what the job role is, entry routes within it, and the key qualifications that will support them. So an entry-level role that is accessible to most people as a starting point for a career in health and social care includes a care assistant or a healthcare assistant. So these wonderful individuals are very hands-on with the individuals that need care and support. So they would support patients, residents, people we support with daily care, mobility, personal hygiene and emotional well-being across hospitals, care homes and community settings. So we might see a starting salary of around 22,000 to 27,000 and an NHS band of 2 to 3. Key qualifications that can be completed whilst within these roles include a level 2 diploma in care, a level 2 adult social care certificate, and the care certificate, which is a workplace requirement. Okay, these qualifications can actually be completed whilst you are working within the role of a care assistant. For career progression, once you have qualified, you would be able to progress to a senior care assistant, a nursing associated, and then ultimately through to becoming a registered nurse. I will tell you all that the workplace qualifications that are available in the health and social care industry are absolutely amazing at helping people to progress to really high level posts and much, much better salaries. The next is a support worker. So a support worker tends to do a little bit less sort of personal care. It might be around supporting people who are fairly independent, maybe just need some guidance or some support. They tend to work with adults with learning disabilities, autism, mental health conditions to live a little bit more independently and be more community-based. So this might be in individuals' own homes rather than a larger, more institutional setting such as a care home or a hospital. Salaries start again between 22,000 and 28,000. And again, we see key qualifications including the level 2 diploma in care, the level 3 diploma in health and social care. Career progression, again, excellent career progression routes within this field, from a support worker to a senior support worker to a team leader to a care manager. There is a hugely growing demand for support workers because we are doing more community-based work. Oh, here we have another role. So this is for a domiciliary care worker. A domiciliary care worker tends to provide personalised care in individuals' own homes, including personal care, care support with medication, meal preparation and companionship. The salary for this starts at about 21,000 and can go to about 26,000, and key qualifications can lead to the level 2 adult social care certificate, the level 2 diploma in care, and a career progression from a home care worker to a senior carer and care coordinator. There is a huge vacancy rate within the domiciliary care worker field at present. Moving on, we have a registered nurse. So this is a very clinical role. You'll see that there as an RN. As part of a registered nurse, you can specify and specialise in different career fields. Nurses deliver evidence-based clinical care across hospitals, community and specialist settings. It is one of the most in-demand and rewarding careers within the NHS, with a salary ranging from 34,000 to 60,000. Key qualifications in order to become a registered nurse, you do need to have a registered nursing degree. You can have a level 3 extended diploma in health and social care through Qualify, which is an entry pathway into those nursing degree programs. Career progression, you can work from a staff nurse to a specialist nurse to something called an advanced nurse practitioner. So advanced nurse practitioners actually have the ability to plan care, write prescriptions, do lots more oversight of patient care. A bit more here about an advanced nurse practitioner. As I said, they are very senior. They have an autonomous clinical role. So they make lots of complex decisions around patient care. They are able to diagnose and prescribe across a range of specifications. The salary for an ANP can rise from £45,000 to £60,000 plus. They do have to have their registered nurse qualification, be registered with the NMC, which is the Nurse and Midwifery Council. They have to have a master's level nursing qualification and 5+ years of clinical experience. Advanced nurse practitioners can progress their career from a consultant nurse to a clinical lead. Here we have midwife. So a midwife is a specialist clinical role. They provide expert care and guidance to women throughout pregnancy, labour, childbirth, and the postnatal period, so the short period of time following giving birth. They could be based in hospitals and community settings. Salary ranges from £34,000 to £50,000. Key qualifications to be a midwife: you will complete your midwifery degree, which is again NMC approved, and this is accessible through the level 3 extended diploma in health and social care. The level 3 extended diploma in health and social care is very often seen as a university entry pathway. So it gives people the amount of qualifications and UCAS points that they need to progress to a degree in nursing or midwifery. Career progression opportunities available for midwives include from a midwife to a senior midwife and then on to a consultant midwife. So medical and clinical roles, some sort of salary overview. Okay, so these are representations of the potential higher end of the sector. All right, as already explained, a qualified level 3 extended diploma in health and social care can help people onto entry pathways into university programs. You have the following medical and clinical roles, which are very, very interesting. So GP, a general practitioner, can earn from £65,000 to £120,000 once qualified and throughout their career. You could have a consultant doctor who can earn from £93,000 to £160,000 plus. A pharmacist who can earn from £40,000 to £70,000, and radiographers who can earn from £32,000 to £55,000. So radiographers, for people who are not sure, are skilled in interpreting and delivering various forms of scans. So potentially things like MRI scans that you might all have heard of. Physiotherapists earn between £32,000 and £52,000. Physiotherapists can also set up in private practice, but they still need to be registered with their professional body. A physiotherapist would support individuals with exercises and opportunities to help physical complaints such as musculoskeletal disorders, arthritis. They might help individuals regain skills they've lost potentially after an accident. Paramedics can earn between £30,000 and £45,000. Okay, and they are very often first responders in emergency situations and are responsible for the care of people within that emergency situation and to transport them on to the next place of their healthcare journey. So, as I've already told you all, at present in the UK, we see 1 in 4 adults having a mental health issue. Okay, so mental health professions are hugely important to us right now. So there's a huge demand for qualified professions. So some of the key roles that you might want to consider as part of your health and social care journey include mental health nurse, a counsellor or psychotherapist, a psychiatrist or a mental health social worker. Now, a huge range of salaries here between 30,000 up to 130,000 because these key roles have very different entry routes, okay, and can also be part of both the NHS or public healthcare sector, but also private roles as well. There's also a huge range of key qualifications that we can support here in relation to developing your mental health career. So we've got a level 2 certificate in mental health awareness, which could come from the awarding bodies of either NCFE or CASH. Level 2 certificate in awareness of mental health problems, a level 3 diploma in health and social care, and psychology or nursing degree for more advanced roles. Then we move on to a regulated profession. So a regulated profession just means that there is a regulatory body that you need to be registered with in order to be able to practice that profession. One example of this is a social worker. So social workers support some of the most vulnerable people in society. All practicing social workers must be registered with Social Work England. So that's their regulated body. They will provide support to adults and children or individuals experiencing mental health or potentially forensic issues. Their role is to support vulnerable individuals to access further services, make sure their rights are upheld, and help make sure they've got access to things like funding that can help them plan and manage their own care. Salary range for a social worker can range from 34,000 to 65,000. A degree in social work is required for registration, and that can be accessed through a level 3 diploma in health and social care, again as an entry pathway. There is also the potential in some areas to complete a social work apprenticeship where you would actually work to get your degree in social work whilst learning on the job. Again, you would need probably the level 3 diploma in health and social care as an entry route into that apprenticeship. Lots and lots of management and leadership roles. So some of these senior roles actually offer really competitive salaries and are central to improving quality and outcome across the service. So one of the first things you could potentially be is a care home manager. Care home managers, some may need to be nursing qualified, depending on the registration of the home, and they can earn between 35,000 to 65,000. But what I will tell you now is that lots of care home managers have actually worked their way up from those care assistant, those entry level positions, all the way through to care home managers, quite often through the sort of learning and development that is available to you here at South London College, and very much through those qualifications, work-based qualifications that help them develop in their roles. You may have a service manager, okay, so again, these might oversee less formal care settings such as the supported living or services for individuals with mental health needs, and they can potentially earn between 40,000 and 75,000. Healthcare quality managers can earn potentially between 45,000 and 90,000, and NHS directors between 80,000 to 120,000 pounds plus. Some of the key qualifications that will help an individual progress into some of these roles include the level 5 diploma in health and social care, the level 5 extended diploma in health and social care, and a level 6 to 7 health and social care management diplomas. So some interesting emerging and specialist roles. Okay, quite a lot of the care roles that we see at present, we desperately need people who have specialist interest in those topics because that's how they get the best care for the individuals who use the service. So one potential is a dementia care specialist. So there is a level 2 certificate in understanding dementia. Okay, and this can help achieve a career as this dementia care specialist with a potential earning of 25 to 45,000 pounds. In relation to autism, There is the level 2 understanding autism, which has the potential to help you become an autism support worker. You would learn a little bit about autism, how it affects individuals, and then learn some key strategies for supporting individuals who are on the spectrum. This can potentially lead to a career with a possible salary of 23 to 35,000. So, palliative care worker. So, a palliative care worker. It's a really tough word to say, everybody. This is somebody who provides care for individuals who are at end of life. So individuals who have been diagnosed with a terminal illness, their role is to make sure that that individual's needs are met, that their journey towards their end of life is as comfortable and as calm as possible, but that the individual's still heard and they are treated with dignity and respect and given as much choice and control over their end of life. The qualification that can help an individual specialise in this field includes the level 2 end of life care. On that qualification, you will learn things like religions, beliefs, preferences around supporting somebody at end of life, and practices that you can embed to support that individual to have choice and dignity and respect. Salary potentials for a palliative care worker range from 26,000 to 42,000. We may also have digital health pathways. Specialists, these are level 5 pathway qualifications with a salary route of 40,000 to 75,000 pounds. Career progression pathways. So every qualification you earn opens the next door. So we actually here at South London College have lots of different pathways that will help you go on to all the way up to these advanced pathways, which can lead to levels 5 to 7, management to executive leadership. First steps, okay, those foundational steps. So levels 2 to 4, entry into those specialist routes. So again, let's flick back to this slide. Some of those great examples we have there, the dementia care specialist, the understanding autism, the end of life care qualification. Those are great qualifications that you can actually undertake without actively working in the care industry. As somebody who used to recruit individuals into health and social care, if somebody was coming into an interview with me and was able to evidence that they'd already completed some of these qualifications, shows a really good interest in the industry and a commitment already. These level 2 qualifications, as I say, lots of them can be done without you actually working in the industry. And one of the reasons I'm trying to make that really clear is because I know from some of the questions I've seen from you all before the start of today's webinar, this is something that a lot of you are asking about, that you are looking for the ability to get into a career in care, but you're not sure what qualifications would help you to do that and if you actually need them. There are further qualifications at levels 3 to 4 that would allow you to then further develop that specialist knowledge, but you would probably need to be working in the care industry to help you develop those. One of the key reasons for this is that qualifications in the health and social care industry tend to be what we call competence-based. So you have to be able to show that you are able to do those things to a high standard. But let me go back to these ones. Again, these level 2 certificates available here are great ways of gaining the initial knowledge needed to allow you to progress through. If your core goal is to progress to leadership and executive roles, once you're working in the industry, lots and lots of opportunities for those work-based learnings that allow you to develop leadership and management skills. Okay, so some of the courses here that we offer at South London College. Okay, so we've got core health and social care qualifications. We've got the level 2 diploma in care. So this is a qualification where you're supported to complete a number of mandatory units and then some optional ones. It's a mixture of both knowledge-based questions, but also work-based observation and putting things into practice. There is also the Level 3 Diploma in Health and Social Care, which is the next step on from the Level 2 Diploma. Now, I do feel that somebody did ask in the questions whether you had to start with a Level 2 Diploma. You can actually start straight with a Level 3 Diploma if you are in the right role in your career. Okay, so in order to achieve the Level 3 Diploma in Health and Social Care, you do need to be doing some senior tasks as part of your job role. So you do need to be able to be updating plans for individuals and also mentoring and developing other colleagues. The Level 3 Extended Diploma in Health and Social Care sometimes can be done without being in the role if it is a knowledge-based qualification. Level 5 Diploma in Health and Social Care, again available through Qualify, and the Level 5 Extended Diploma in Health and Social Care would be for those people who are able to show that they work in senior positions within an organisation and have some sort of management responsibility. The mental health and specialist certificates, so all of these level 2 certificates are available to complete even if you aren't already working in a care setting. There is the level 2 mental health awareness, which takes you through an overview of the mental health understanding. So understanding what mental health is, understanding what well-being is, understanding how mental health issues may be caused, understanding a little bit about each of some of the mental health issues and how they might affect individuals in their daily life, and what support is available for individuals who experience mental health conditions. The Level 2 Autism Awareness, as I said, gives you an overview of what autism is, the impact of it on individuals' daily living, and some of the strategies that might be useful supporting individuals who live on the autism spectrum. Level 2 End of Life Care, like I've already said, a little bit about understanding what might affect an individual's choices around their end of life journey. And level 2 diabetes gives you an overview of the different 2 types of diabetes, how they're different to each other, some potential causes, and then again, treatments and support available for individuals living with diabetes. All of these courses have 365-day access, are fully online, Ofqual regulated, and have UK awarding bodies. So they are absolutely accepted across the health and social care industry by all employers. So we have here some offers for you that are available because you have attended our webinar today. Okay, they're available to you as webinar participants, and we would remind you to take advantage of these before they do expire. There is a £50 discount if you use code webinar at the checkout on selected courses, and that's valid only for 7 days from today. There is a buy one, get one free offer. So selected courses are available on a buy one, get one free offer. Enroll today and get a second course at no extra cost. And free certificate of participation. So all of you that have attended today will receive a certificate delivered by email within 3 to 5 business days. So these offers are available for you exclusively because you've attended our webinar and expire in 7 days. So do try to take advantage of them. Some information for you. I'm going to pause on this screen for a few minutes in case you want to take screen grabs of the QR codes to go on and get some further information. So these are all the various routes that you can use to get in touch with us here at South London College. So our website, southlondoncollege.org, our email, info@southlondoncollege.org. Telephone is 020 8126 0422 with an international UK dialing code of +44. You can WhatsApp us on +44 77 4843 3424. And you can write to us at 52 Grosvenor Gardens, London, SW1W 0AU in the United Kingdom. You can also follow us using any of those social media QR codes that are on your screen. So questions and answer sessions. I'm actually going to stop sharing my screen so that I can see the chat and see if anybody does have any questions. I'm going to give people plenty of time to think about anything that they might want to put into the chat. Okay, and honestly, if I can't answer the question for you today, we will definitely go and find it out for you and make sure you get a response. So let me just stop sharing. So while I was sharing my screen there, you couldn't see me, but now you should be able to. So I'm going to have a look at the questions and answers. So I've currently got no questions or answers visible. I'm going to give everybody plenty of time to use that function. Oh, Katerina, thank you ever so much. Okay, I will answer some of the questions that came through on our chat prior to the session today. Okay, so one question that somebody has asked, I have heard that working in health and social care can be emotionally very demanding. Is there any support or guidance built into the courses to help students prepare for that side of the job? So there absolutely is. Many of the diplomas and many of those short qualifications ask practitioners to reflect on what they can do to look after their own well-being. They include you to think about learning how you do that. So, thinking about how you look after your own physical and mental health when you're providing support to individuals in a health and social care setting. It is an emotionally demanding job. We do want you to emotionally care about the people that you are providing care and support to, along with having professional boundaries. Okay. But all of us would like to feel that the people who are delivering care to us are delivering it in a way that they feel like they want the best outcome for us. Having said that, we do also understand that it is a professional role and we don't want people coming into work with all their own personal problems that might impact how they support individuals. Some of the things you might learn about when you're completing these qualifications is identifying what stress looks like in yourself, okay, what it might look like in colleagues and others, so that you can help get appropriate early intervention and support. We do encourage throughout these qualifications that you spend time speaking to line managers, trusted colleagues, employee assistance programs, things like that, about your own emotions and responses to situations. And again, they very often teach those techniques for managing stress and emotions. So things like getting outside, getting some exercise, looking after your own diet and hydration, thinking about what hobbies and interests you can have outside of work that will help you to switch off and not become overloaded. One of the reasons that there is quite a high turnover rate within health and social care is that it can be emotionally demanding. And where we don't look after our own health and well-being, we might experience something called burnout. However, that is also now widely recognised within the health and social care industry, and lots of employers do an awful lot of work with their staff around looking after their own mental well-being whilst they're in the role. I have three more questions. So I have just finished my Bachelor of Science Honours in Psychology. I'm an international student and I'm interested in mental health careers. Could you please tell me the best options available for me? So absolutely, definitely, we are crying out for mental health support workers. So looking through job roles and sites like Indeed, LinkedIn, places like that. Getting into a mental health support worker role is a very good way of progressing and using those skills that you've got there in psychology. Um, Mental health support work might range from supporting individuals in their own home that just need a little bit of support with tasks of daily living or staying on track with their medication or arranging employment, but also about supporting people who might be experiencing crisis, so making sure that they can access support around that. And then there's also much more complex mental health services. So quite often you can look at healthcare assistant roles within private or NHS hospitals that specialise in mental health. So there's a huge amount of opportunities available to you there. Short courses, Caroline. Yep, we do have short courses, those level 2 certificates, so around understanding diabetes, autism awareness, dementia, end of life. 1 minute, I'll come back to you, Benuri. They're definitely worth coming and having a look on the website, using those offers you've had today, Caroline, to see if you can access one of those courses. Again, you don't actually actively have to be working in the industry to complete those level 2 certificates, and they're a great way of you thinking about whether you would like to specialise with any sort of health conditions or groups of individuals. And I would like to know the roles I can take just through my degree without studying further. So, any of those roles I just mentioned, so a mental health support worker, healthcare assistant within a mental health field, you would potentially need to take further qualifications to get into things like counselling and therapy. But they would potentially be open to you once you're in one of those entry-level positions, such as the mental health support worker or healthcare assistant. Oh, Caroline, you're welcome. Thank you. I'm just clicking your answers off as answered. I'm going to go back to the questions that people dropped in before today, just in case any of you are here and do still need an answer to those questions. So the next question that we got for today, I'm currently working in a completely unrelated field, but I genuinely want to move into care. How long would it realistically take me to go from starting a course to actually being employable in a care role? Care is a really interesting industry in the sense that for many of the entry level roles, you don't need a formal qualification. However, in some geographic areas, the actual competition for care roles can be quite competitive. So one of those short level 2 certificates, or even doing a couple of those to maybe have a really good think about what you might want to specialise in. So whether you'd be better placed working with adults with autism or learning disabilities, or whether dementia care or end of life care is more for you, they're a really good start route into them, and you don't actually need any current care experience to be able to complete those. They're relatively short courses. There's quite a flexible amount of support available to you because they're delivered online. You would be able to complete them quite quickly, and they'd be great on your CV if you're applying for those job roles within the care industry. Shows a real interest in it and a passion for supporting individuals in care. Benuri, how can you make your CV attractive for those mental health roles? Could you please give you some tips? So, for a start, you've got a really interesting degree in psychology. Maybe some of the things you could do to make your CV a little bit more attractive is maybe do a little bit of volunteering, potentially with a mental health organisation such as Mind. You could potentially take one of those short level 2 qualifications, so the mental health awareness, showing that real sort of specialist understanding of mental health conditions and very practical applications for how to support individuals. And that's what's nice about those level 2 qualifications. They give some really good learning around practical things that you can do to support individuals living with each of those conditions. And also, actually, for mental health, not just the mental health awareness certificate, you might find it really useful to do the autism as well, because services in the UK are not very good at defining the difference between those two conditions, and we quite often see a little bit of an overlap. And again, some of the strategies that you might use for supporting autism are sometimes really useful in mental health. But it'd give you the ability to talk about those strategies that you might not already have learnt about through doing your psychology degree. Was that helpful? I hope so. If not, ask another question and I'll try and answer it. Okay, another question that we've had in: do I need any prior care experience before I can enroll on a health and social care course, or can I start from absolutely zero with no background in the sector at all? Yes, you can absolutely start with no background in the sector at all. Okay, great, do. Thanks, Benure. I'm glad that I've answered your question. So yes, again, like I've already said, care is one of those really interesting industries where we can see people starting with absolutely no prior experience. When we're recruiting in health and social care, we tend to recruit around values. Okay, so we understand that we can teach you how to deliver care. We understand that we can teach you about policies and procedures and the right way to do things. But we can't teach you how to care about others or want to make other people's lives better. Okay. Again, I will go back to those short qualifications. So again, for me as a recruiting manager, I'd be really interested in somebody who's already shown a commitment by completing one of those short qualifications, because this is the industry that they want to get into, as opposed to a job that they're doing because there are not a lot of other options out there for them. It just shows the thing we're already looking for, which is commitment, care, wanting to do really well in the industry. So do think about those level 2 qualifications. They're not mandatory. You don't need to have them to get into the industry, but they might just help you to stand out from other candidates, particularly if you're going for roles where other people have experience. Rajan: does a level 3 diploma in adult care improve opportunities to work in the NHS with 4 years of domiciliary care experience in private home care? Also, how should I strengthen my CV? Yes, it does. So sometimes getting on as a HCA within the hospital, they do sort of expect people to already have completed some formal qualification. A level 3 diploma massively improves your opportunities. Focus on those 4 years of domiciliary care that you have completed. Strengthen your CV by talking about the skills that you've got. Focus around things like the 6 C's of care, so care, compassion, communication, commitment, courage, okay, and competence. Talk about the tasks that you are able to do with individuals, such as overseeing medication management, meeting GDPR regulations in relation to record keeping, being highly aware of safeguarding issues, thinking about potentially some of those medical sort of tasks you might have completed with individuals, such as being aware of how to monitor things like BMI, some of the medical conditions that you might have worked with individuals in a domiciliary setting. So do you have a strong awareness and understanding of dementia? Do you need to do one of those level 2 certificates to improve on that, so you can use vernacular and terminology around it? Maybe focus on some of the needs that individuals you've supported have. Okay, so like I said, diabetes, physical disabilities, ability to use hoisting equipment safely, all those sorts of things will really strengthen your CV. Useful or not? Do you need more? I will go back to the other questions that were emailed into us. Good. I'm glad that was useful, Raja. Da, 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 da. Perfect. Another question. I'm already working as a care assistant, but I don't have a formal qualification. Would I need to start at level 2, or is there a way to assess what level is right for me based on my existing experience? Yes, you would not need to start at level 2. Okay. But you probably do need to be able to be working in a position where you can evidence that you coach and mentor others. Now, if you are a care assistant, I would say that would depend on what sort of care setting you work in. For instance, in a domiciliary care setting, it's easier to do the level 3 because you're working really independently. You tend to lead the calls that you visit on. In a nursing home, working as a care assistant, you might need to do the level 2 because they're very often nurse led and not a lot of autonomy from people working as a care assistant. I would suggest that you give us a call here at South London College, ask to talk to one of our care specialists to see which is the right progression route for you, given the job role that you're in at present. Okay. Any more questions from anybody? I have one more that came in on the chat function prior. Can I study while working part-time or full-time in a care role, and will completing a course help me get promoted in my current job? Absolutely, yes, you can study part-time or full-time whilst you are working another career. That's one of the beauties of the qualifications that we do here. They're fully available online. You can do them at a time that works for you. So if you're somebody who perhaps has a couple of hours in the evening after work or something like that, all your learning is widely accessible and you are able to get on and do that at a time that works for you. Yes, completing these qualifications would allow you to get promotion. They're not automatic. You still would have to go through interview routes, etc. But what it would give you, completing some of these qualifications, is a few of these things that I'd look for as a manager. So I'd be looking for somebody who is committed. So the fact that you've gone off and done a qualification on your own, brilliant. Shows that you're committed, shows that you want to progress. It'd also improve things like your terminology and your understanding of key concepts working in health and social care. So you might be able to then evidence in the interview a better understanding of how to support somebody with a mental capacity assessment. You might be able to evidence in your interview a better understanding of safeguarding and what you should be doing around that. Any further questions from anybody? Oh, somebody has popped their hand up. Now then, Caroline, I can see that you have popped your hand up. If you have a question, if you pop it in the chat for me, that would be really useful. I will also try and open. That was a mistake. That's okay, Caroline. I'll let you off. I don't know how to make you. I think you might need to pop your hand down, but I know that you didn't need it. Don't worry, don't panic. Honestly, everybody, if you want to ask any questions, now's the time. We just have a few minutes left in our webinar session. If there's any of those qualifications you want me to go back over, give you a better understanding of, potentially talk about what you might learn in them, please feel free. I am just going to check. Reem, you are an overseas dentist. So I take it then that you would need to do some sort of UK-based qualification to re-register as a dentist within the UK, which is really frustrating. I know that. I suppose the kind of thing you're going to need to be thinking about is going back into identifying what UK-based qualification you need in order to be a dentist, whether it is the amount of hours you need, CPD, so continuous professional development, to meet the qualification specifications for requalifying. It is really complicated because actual hands-on dentistry experience is probably not very relevant in most health and social care jobs. There is elements of supporting people with oral hygiene in most of these jobs. However, not the level of understanding that would be necessary to support much CPD in the field of dentistry. But there are always all the other things you can focus on in a health and social care role, such as those customer patient care skills, enabling communication, understanding safeguarding, understanding health and safety, infection prevention and control, things like that. They're all embedded within those health and social care jobs and qualifications. Minutes be able to see all of our contact details again should you require any further information about any of the courses you've talked about today, want a little bit more specific advice about courses that might meet your requirements, or if there's anything else at all we can do to help you. I am just going to check the chat function again, and there are no further questions popped up. Okay, I will come back to make sure I can see you all, see if anybody's got any questions. Again, just to double check. And I feel like, nope, nobody has asked anything else. I will say that we are just 2 minutes from the end of our time now, so you might be disconnected from the room very shortly. Thank you ever so much, everybody, for coming today. It's been absolutely fantastic to share a bit of information with you about the health and social care industry, and really lovely questions that have come through from you all. And if you can talk about really wanting to work in care and being committed towards individuals who use care services, they're really good things to talk about in interview positions. And as I kept saying, those level 2 in qualifications are a really good place to start. And to show that you're really committed to the idea of working in the health and social care field to potential employers. And yes, I do feel that is now the end of our time together. As I say, please feel free to use our contact details should you require any further assistance. Thank you, everybody. Have a lovely weekend.